So transient tachypnea of newborn or TTN is where the fluid-filled lungs, fetal lung fluid, with inadequate clearance of this lung fluid due to rapid delivery, especially without an active labor process. Usually it's in term babies, and elective cesarean is a common association. Precipitate labor because of the rapidity of delivery is a factor as well. Usually, baby presents with early onset respiratory distress. Those sub-babies may present with distress after 3 to 4 hours of age, especially when the initial symptoms are just a mild moan or a grunt. The respiratory tachypnea may worsen with time, and the baby cannot keep the complaints of the lung with the PEEP alone, with the grunting related PEEP. This usually settles down over 24 to 48 hours with supportive management, and CPAP is helpful in these babies or high flow, depending on the situation. And very rarely they may need mechanical ventilation as well. You might see some of these babies having frothy secretions in the mouth, and it's part of the predisposition. And obviously, you may have to rule out a tracheoesophageal fistula in these cases as well by inserting a feeding tube. Just a quick illustration of the amount of lung fluid. And so we have 25 ml per kilo in the late gestation. And with the onset of labor, effect of cortisol, thyroid hormones, epinephrine, and selective, the sodium channel reverses to the highly selective one from the non-selective. So instead of the chloride and water coming into the lungs, it starts going out into the capillaries. So this reduces the fluid with the onset of labor to 18 ml per kilo, and then it drops to 6 ml per kilo by the progress of labor. And epinephrine is more important and during the labor process, and it drives the sodium and water out. And the squeeze effect during the vaginal may reduce the last part of it. So by the time the baby is born, the fluid is mostly cleared. However, in a cesarean section, the baby is born in this stage, so we still have a good amount of lung fluid, which is 20 to 25 ml per kilo. So the baby has a high risk of TTN. CPAP works by keeping the lung distended, and this will clear the lung fluid with time. The chest X-ray is typically with streaky shadowing, and we see the lines, and we can see the interlobar fissure on the right as well. Overinflation is typically a feature of TTN, and in the early stages, you may find pleural effusion-like picture on the rim of the lungs. So as we discussed, coarse perihilar streaks, prominent lung vasculature, and there is evidence of interstitial and pleural fluid, prominent interlobar fissures, and overinflation.